Thank you. I'm here to talk about what we call soccer in the United States, football in the rest of the world, but to do so I have to be properly dressed. So I've been coaching girls soccer for over 20 years, and it's one of my passions. It might surprise some of you to think about football and to think that the most important part of the game are not the shots that you take on goal. The most important part of the game is actually the first touch. What happens when the ball comes to your feet? Because if you can't control it, at that point the other team will get the ball. So you have to decide what you're going to do with the ball as it approaches you. If you wait until it gets to your feet, neurologically, any neurologists in the crowd will tell you it's very difficult to send the signal down to your brain. So one day I was coaching my 11-year-old girls in soccer, and I was explaining this to them. I would say, look, you have to think about what you're going to do with the ball as it approaches you. Decide whether you're going to stop it, or you're going to dribble, you're going to shoot, you're going to pass to yourself. What are you going to do? Got it? Got it. Right. Okay, let's try it. Ball comes rolling to Margaret. Without thinking, bam, kicks it away to nowhere. And I say, Margaret, you weren't thinking about what you were going to do with the ball before it got to you. Oh, no, Coach, I was thinking about it. I just hadn't reached a conclusion. So what do we learn from this? What do we learn from this? We learn from this that people learn in different ways. Some people learn didactically. 11-year-olds don't, obviously. Some people learn kinesthetically. Other people learn through the Socratic method. If you're running a hospital, or if you're a chief of service, or you're the head of a division or department, part of your job is to teach those people in the hospital how to improve. Why do we care about improving things in hospitals? Well, in the United States, every day a 727 airliner crashes and kills everybody on board. Every day. Not really. But that number of people every day in the United States are preventably killed in hospitals. Not die from their disease, killed. And they're proportional numbers in every other country. So we need to work with the medical staff to improve and change the way in which care is given in order to alleviate that problem. We need to invest in process improvement. Now, a big part of the problem, though, is how we deal with mistakes. This is Tova. She's now 28 years old, and I had lunch with her a few months ago, and she said to me one day, do you remember the tournament we went to in Connecticut when I was 14? Here she is at age 14. She's 28. And I said, oh, yes, I remember it exactly, because I remember every tournament. And I said, you were spectacular. You were playing defense. Our goalie knocked the ball out of the net. It went out into the field, and an offensive player took a point-blank shot right at the goal, and you, as the defender, stopped it with your chest and cleared the ball. She says, I don't remember that play. I said, oh, what do you remember? She said, well, I remember the play where a ball was coming flying towards the net. I was the sweeper, the last player. I tried to head it out, and instead I deflected it into the net, where it scored the winning goal of the tournament for the other team. She said, I was devastated after that. I was sitting on the grass, sobbing my heart out. And you came up to me as coach, and you said, Tova, don't worry about that. You're a great defender. I am? Yes. Only the best defenders go out after every ball and try to boot it away or get it away from the goal. And only the best defenders do that every time, and every now and then the ball deflects and it goes into the net. It's okay. It happens. She said to me a few months ago, I brushed myself off, walked away smiling with my head up, saying, I am a great defender. She said, she remembered this 14 years later. She said, that season was very memorable for me. You never know when a kind word you say to a person who's in distress is going to make a difference in their life. Think of doctors. Doctors are extremely well-intentioned people, highly trained, we know that. They devote themselves to alleviating human suffering caused by disease. They devote their entire life to alleviating human suffering caused by disease. Doctors are trained that they should not make mistakes. We can understand why they're given that message, but think of the burden that puts on a doctor. You shall not make mistakes. That's unreasonable. In no other profession in the world do we say to people, thou shalt not make a mistake. What we say to people in other fields is, when you make a mistake, or when you almost make a mistake, when you have what we would call in medicine a near miss, think about what you can learn from that. In our hospital, we had a patient wake up from surgery one day and look at her leg and say, why is the bandage on my left foot instead of my right foot? And it was at that moment that the orthopedic surgeon realized he had operated on the wrong leg. Now, there are lots of reasons for this, and we can go into that at a different conference. But the issue that came up at the time, in a discussion I had with our board of trustees, our governing body of the hospital, they said to me, what are you going to do to punish him? And I said, I'm not going to do anything to punish him. He's already had more punishment than I could ever impose on him. He took an oath to do no harm, and he knows that he did harm. And so that was my reason for not wanting to punish him. But the head of our physician organization said, there's a more important reason not to punish him. If we want to establish a culture in our organization that encourages and permits people to admit their mistakes and their near misses, we are more likely to establish that culture if we do not punish doctors who, with their best of intentions, make a mistake. They've already suffered enough, but we need to create a learning environment for our community of these highly trained, well-intentioned people so that we can engage in constant improvement going forward and going forward and going forward. This is my championship soccer team, the 11-year-olds. Here's what it takes to make a championship team, whether on the field or in a hospital. We have to give enough of ourselves to let the filaments connect us as teammates. We have to give enough of ourselves to let the filaments connect. We can only do that if we are prepared to forgive mistakes. We can only do that if we can learn from the mistakes that are made or from the near misses that occur. We have to help these poor doctors who've been given a tremendous burden in their life, in their training, in being told that they cannot make mistakes, because they will make mistakes. Our job as leaders, our job as patients, our job as colleagues is to help them learn from those mistakes, to let the team coalesce, to connect the filaments among us, and to have a championship team. Thank you very much.